Imagine your body has a repair manual, instructions written in your cells that tell tissues how to heal, blood vessels how to grow, and inflammation when to stop. But what if those instructions got lost somewhere along the way? Well, today I'm talking about peptides, tiny protein fragments that act like biological text messages. Two of them, BPC-157 and TB-500. They're showing remarkable promise for gut repair, joint recovery, and tissue regeneration. But here's what nobody's telling you. Women respond differently to these healing signals, especially during hormonal transitions. And today, we're uncovering the science behind these regenerative peptides, actually needs them, why your doctor might not know about them.
Did you know sweating can literally heal your cells? Infrared saunas don't just relax you, they detox your body, balance hormones, and boost mitochondrial energy. I'm obsessed with my Health Tech sauna. And right now, you can save $500 with my code at healthtech-health.com/dr-muth-req-25.
Welcome back to Let's Talk Wellness Now, the show where we uncover the root causes of chronic illness, explore cutting edge regenerative medicine, and empower you with the tools to heal. I'm Dr. Deb, your medical detective, and today we're diving into regenerative peptides BPC-157 and TB-500. If you or someone you love is struggling with slow recovery from injury, chronic joint pain, gut inflammation that just won't quit, or you just feel like your body doesn't bounce back the way it used to, this episode is for you. Grab a cup of coffee or tea or whatever helps you unwind, settle in, and let's start you on your journey to deeper healing. We'll do another sponsor break here. So let's start with the question I hear constantly in my practice. Dr. Deb, I'm doing everything right. I'm eating clean, I'm exercising, I'm taking my supplements, but I'm still not healing. What am I missing? Well, that answer might surprise you. Sometimes it's not about what you're putting in your body, it's about whether your cells are actually receiving the repair signals they need. That's where peptides come in. Think of peptides as the body's original communication system. These short chains of amino acids are like biological post-it notes, carrying instructions from one cell to another. They tell your human system when to calm down, your blood vessels when to grow, and your tissues when to repair. Now, here's where it gets interesting for women specifically. We know that estrogen plays a massive role in collagen production, vascular health, and inflammatory response. When estrogen starts declining, whether that's perimenopause, postpartum, or even from chronic stress, our natural repair mechanisms slow down dramatically. You might notice it as my joints are aching more, I'm a little more fluid filled, they hurt when I bend them, my injuries take twice as long to heal, gut issues that suddenly appear out of nowhere, and no matter what you do, they don't seem to repair. Skin has lost its elasticity, or just this general sense that your body isn't keeping up anymore. This is where BPC-157 and TB-500 enter the picture. So BPC-157, short for Body Protection Compound 157, is a naturally occurring peptide sequence found in your gastric juices. And according to a 2024 systemic review published in Emerging Use of BPC-157 in Orthopedic Sports Medicine, this peptide promotes something called angiogenesis. That's the formation of new blood vessels, and they deliver oxygen and nutrients to damaged tissues. Now, TB-500 is a synthetic fragment of thymosin beta-4, a protein your body makes naturally during wound healing, and research published in Therapeutic Peptides in Orthopedics in 2025 shows that it works like a cellular first responder, rushing to injury sites and coordinating tissue repair through a process called actin regulation. But here's what makes these peptides different from just taking another supplement. They don't force your body to do anything. They simply remind your cells how to heal the way they used to. And for women navigating hormonal changes, autoimmune flares, chronic inflammatory conditions, that distinction matters enormously. So, all right, let's get into some of these mechanisms, because understanding how something works helps you make informed decisions about whether or not it's right for you. So let's look at the science. Do these peptides actually work? And if so, how do they work? Let's start with BPC-157. This works works through multiple pathways simultaneously. First, it activates growth factor receptors that stimulate fibroblasts. Those are the cells responsible for making collagen and rebuilding connective tissue. And according to research published in Frontiers in Pharmacology in 2023, titled Regeneration or Risk, BPC-157 also modulates nitric oxide signaling, which enhances vascular repair and reduces oxidative stress at the cellular level. So this is really important because many of us are nitric oxide deficient, especially as we get older. Especially since the pandemic, we're seeing a lot of people being more deficient in nitric oxide. And you're taking nitric oxide, many of you, to help with this process. But if we're having other issues that don't allow that nitric oxide to get where it needs to go, that could render it completely useless. So in plain English, when we're talking about how BPC-157 helps the blood vessels work better and protects your mitochondria, big word for your energy factories in your cells, from that inflammatory damage. Now, there's studies in musculoskeletal and gastroenterology models that show BPC-157 decreases inflammatory cytokines like TNF-alpha and IL-6. And these are chemical messengers that keep inflammation turned on. So by dialing them down, BPC-157 creates an environment where healing can actually happen. Now, where do we know about this TNF-alpha and IL-6? Well, we know it from viruses, we know it from Lyme disease, we know it from mold toxicity. These cytokines are turned up. They're creating a massive inflammatory response in the body, and you're struggling to get these things down because of that or potentially other reasons. So here's where it gets really interesting with women in perimenopause or menopause. When estrogen declines, collagen synthesis slows down. And that's why we see increased joint pain, slower wound healing, and our changes in the skin's elasticity during this transition. We see the little wrinkles, the fine lines, we see the subcutaneous fat going away a little bit more. This is partially why this is occurring. And so from research shown in the Journal of Orthopedic Research in 2023 by Leibowitz and colleagues, that they suggest that BPC-157 affects on the endothelial layers, so the cells lining the blood vessels. And these may mimic some of the estrogen's protective vascular effects without actually affecting your hormone levels. This is really huge because we know that as women lose estrogen, they have a higher risk for vascular events. Heart attack, stroke, things like that. And if people have already had a heart attack or a stroke, we typically recommend that they don't use estrogen because that could potentiate the risk for another heart attack or a stroke. But that means that you don't gain the benefits of estrogen either. If we think about this, we could potentially use BPC-157 to give us some of the benefits that we lost from having estrogen and potentially not being able to use estrogen. And that would be huge for us. And not to mention the reduction of inflammation and the joint pain and the wound healing and the energy and the gut feelings. I mean, there's just so many benefits to BPC-157 that we could talk about them all day long. But we've got to move on. So let's talk about TB-500. Now, this peptide works very differently. Its primary job is promoting cell migration, essentially telling repair cells to go to this spot and what to do when they get there. So it sends a signal, puts a little post-it stamp there and says, hey, when you get there, fix A, B, C, and D. And there was a study in 2024 in Cell Biology International that demonstrated that TB-500 increases epithelial closure and improves tendon elasticity in models of repetitive strain injury. So let's think about that a little bit. What does that really mean? That means faster recovery from exercise-induced muscle damage, better healing of overuse injuries like tennis elbow or plantar fasciitis, improved scar tissue, remodeling after surgery or a C-section, enhanced recovery from chronic inflammatory conditions affecting soft tissues. And I've talked about this several times. I have used these compounds post-surgical personally. And I remember going back to see my surgeon at the 2 to 3 week mark for follow-up, and she was amazed at how well everything was healing. And when I asked her if she wanted to know what I was doing, her response was no, but keep doing whatever you're doing because it's working. And after 3 weeks of a major pelvic repair surgery that I had, 4 hours in surgery, lots of sutures, not comfortable, I was actually walking a mile and didn't have pain, and I was recovering really well and felt amazing. And that is just not typically heard of in surgical procedures like mine. It's usually a minimum of a 6 to 8 week recovery before you're starting to do that again. And I give all of the credit to these two peptides. In my clinical practice, I see this play out constantly. Women who train hard, whether that's CrossFit, running, yoga, or just trying to keep up with active kids, often hit a wall where their recovery can't keep up pace with their activity level. And TB-500 helps to bridge that gap by optimizing the body's natural repair timeline. But here's what I want to emphasize with you. These peptides aren't magic bullets. They work best when we combine them with proper nutrition, an anti-inflammatory diet, adequate sleep, stress management, and we address the underlying root cause like the gut dysfunction or those hormonal imbalances. And they work much better when the hormones are balanced versus when they're not. They're amplifiers of your body's existing healing capacity, not replacements for foundational health practices. So let's have some real talk here. Let's talk about evidence and what you need to know about that. Now let's address the elephant in the room: regulatory status and safety. Neither BPC-157 or TB-500 are FDA approved for human medical use. They fall into a category called research compounds, and that means they're legal to possess and use, but they're not approved as pharmaceutical drugs. And hopefully they will be back on our list of things to use relatively soon with the changes that Bobby Kennedy has made to peptides recently. So why does this matter? Because quality becomes a concern. Quality control is absolutely critical. You need to know where these compounds are manufactured, their source, their testing, their clarity, everything about them. There was a 2025 review in Therapeutic Peptides in Orthopedics that concluded both peptides demonstrate strong regenerative signaling with minimal systemic side effects in preclinical studies. But, and this is really important, most of the robust data we have comes from animal models and cell culture models, not large-scale human clinical trials. Now, that doesn't mean that they don't work. It just means that we are still in the early stages of understanding optimal dosing, treatment duration, and long-term effects in humans. So why do we have all of this great peptide information and we don't quite have the ability to use them yet? Or it's extremely restricted? That comes under the guise of the FDA. It came through the past administration with Biden, where he removed a bunch of these peptides from the market. Both BPC and TB-500 were on the list of safe peptides to use before Biden made his changes, and it looks like they may be coming back relatively quickly for us here. So what we do have is growing clinical feedback from practitioners like myself who use these peptides in practice under careful supervision and under pilot studies on musculoskeletal recovery published in our organizations that we work with. So all of our information is documented and it is done under an observational study. There are other studies published in orthopedic and biomedical research from 2025 that actually found BPC-157 reduced pain scores by 35% and improved functional mobility within 8 weeks. This is really phenomenal because many people over the age of 40 are reaching for the Tylenol bottle, the Advil bottle, the Aleve bottle, which does a number on your kidneys and your gut and your liver. And it is really problematic to be using these things on a regular basis. And if we can use a compound that's safe, that preserves the kidneys, the liver, and the gut, why don't we do that is the question that I have. Now, we see a lot of the same information in our clinic that we see in these studies. And it is the following things that we see. significant reduction in joint pain and stiffness. I have a person that was looking at doing a knee replacement, and we did 10 weeks of these two compounds, and her knee pain reduced so much that she decided she didn't feel like she needed that knee replacement right away, which is good because she's only 60 years old, and the length of that knee replacement wouldn't be as long as it would if she could wait 5 or 10 years. The doctor didn't say she needed to do it right away. She wasn't that critical, but it was the pain that was driving her to the replacement. And so if we could preserve that and give her a reduction in pain, all the better to do that. We get faster recovery from surgical procedures, improved gut symptoms, especially in cases of leaky gut or inflammatory bowel conditions, better skin quality and wound healing, enhanced overall sense of resilience and recovery capacity. But here's what you absolutely must know before considering peptide therapy. First, source matters. Because these aren't FDA regulated pharmaceuticals, quality varies widely, and you need to work with a physician who sources from compounding pharmacies 503A or 503B that provide certificates of analysis, third-party testing, and proper sterility verification. Secondly, context matters. Peptides work best as part of a comprehensive functional medicine approach. So if you're still eating inflammatory foods, drinking alcohol, not managing your stress or your sleep, you have unaddressed gut dysfunction, and these peptides alone won't fix those problems. Thirdly, realistic expectations matter. These aren't overnight miracle cures. Most patients see gradual improvements over 4 to 12 weeks. Some respond dramatically, others see modest benefits. Individual variation is real. And fourth, medical supervision matters. Dosing, injection technique, monitoring for side effects, and knowing when peptides are or are not appropriate. All of this requires clinical expertise. Now, let me bust a few myths here because I hear this constantly. Myth number 1, peptides are just for bodybuilders and athletes. That is false. While athletes use them for performance recovery, the therapeutic applications for chronic pain, gut healing, and age-related tissue decline are profound for everyday people. Myth number 2, peptides will mess with my hormones. False. BPC-157 and TB-500 don't interact with your endocrine system the way hormones do. They work through growth factors and cell signaling pathways. They are very different. Myth number 3, if they're not FDA approved, they must be dangerous. Not accurate. Many effective therapies exist in regulatory gray zones. What matters is quality sourcing, proper medical oversight, and informed consent. So the bottom line here is that these peptides show real promise backed by mechanistic science and growing clinical expertise, but they require responsible use, quality products, and realistic expectations. Now, let's talk about practical integration. Who should consider peptides? Well, so who actually benefits from the peptides? Let's start there. Let me walk you through the 3 main categories I see. Number 1 is gut restoration. If you're dealing with chronic gut inflammation, whether that's IBS, inflammatory bowel disease, leaky gut, persistent digestive issues that haven't responded to dietary changes alone, BPC-157 can be transformative. I had a patient recently, I'll call her Sarah. She's been struggling with severe gut pain and food sensitivities for 3 years. She tried elimination diets, probiotics, gut healing supplements, everything. And within 6 weeks of adding BPC-157 to her protocol alongside the targeted nutritional therapy, her pain dropped by 70% and she could tolerate foods that she hadn't tolerated in years. Why does this happen? Because BPC-157 directly supports mucosal integrity, the protective lining of your intestinal tract, and it reduces inflammatory cytokines and promotes healing of damaged tissue. Number 2, muscle and joint recovery. This is where I see TB-500 shine. Women who are active, whether you're a runner, a yogi, a CrossFitter, or someone who just wants to keep moving without pain, they often hit a point where recovery becomes a very limiting factor. And maybe you're dealing with chronic tendonitis, a nagging shoulder injury, a bad back that just will not quit, or just general achiness. It all makes you feel older and keeps you from being active the way you want to. TB-500 combined with therapies like red light therapy, PEMF, or targeted physical therapy can dramatically accelerate soft tissue healing. I've seen recovery timelines cut in half for patients dealing with overuse injuries. Number 3, menopausal transition support. This is where the intersection of peptides in women's health gets really exciting. During perimenopause and menopause, declining estrogen affects collagen production, vascular health, and joint integrity, along with inflammatory processes and responses. Many women notice they just don't heal as quickly and their joints hurt much more. Besides noticing their skin changes and their injuries linger longer. Low-dose peptide protocols, often combining BPC-157 for vascular and gut support with TB-500 for soft tissue repair, can complement bioidentical hormone therapy or stand alone for women who can't or don't want to use hormones. Now, I'm not saying that peptides replace your hormone optimization, but they can be powerful adjuncts that support tissue resilience during a time when your body's natural repair mechanisms are shifting. Now, who should not use peptides? If you have any active cancer or a history of certain cancers, peptides that promote cell growth and angiogenesis might not be appropriate. If you're pregnant or breastfeeding, we don't have safety data. If you have severe kidney or liver disease, clearance and metabolism could be affected. You want to work with a practitioner who really understands this and be under medical supervision for these kinds of conditions. This really matters. A qualified functional medicine practitioner can assess your individual situation, run appropriate labs, and determine whether peptides fit into your overall healing strategy. Remember, peptides are tools, they're not magic. They work best when you're also addressing nutrition, sleep, stress, movement, and underlying root causes. They amplify your body's healing capacity. They don't replace the fundamentals. This is really important to understand. So, thank you for joining me today on Let's Talk Wellness Now. If this episode resonated with you, share it with another woman who's ready to reclaim her body's natural healing capacity. Remember, wellness isn't just about feeling good, it's about thriving in every area of your life. Your body was designed to heal. You're not a small version of a male. You are a woman with different biochemistry. And sometimes it just needs the right signals and the right support to remember how. If you're ready to explore personalized regenerative medicine or peptide therapy as part of a comprehensive functional medicine approach, you can visit us at serenityhealthcarecenter.com. You can also follow us on Instagram, and you can look at my book, Seen at Last, and join the Seen at Last free community on Facebook, where we will provide all of this information and more for you. Until next time, I'm Dr. Deb, reminding you to take care of your body, mind, and spirit. Be well, and I'll see you in the next episode.
Welcome to Let's Talk Wellness Now, where we bring expert insights to you. Please note that the views and information shared by our guests are their own and do not necessarily reflect those of Let's Talk Wellness Now, its management, or our partners. Each affiliate, sponsor, and partner is an independent entity with its own perspectives. Today's content is provided for informational and educational purposes only and should not be considered specific advice, whether financial, medical, or legal. While we strive to present accurate and useful information, we cannot guarantee its completeness or relevance to your unique circumstances. We encourage you to consult a qualified professional to address your individual needs. Your use of information from this broadcast is entirely at your own risk. By continuing to listen, you agree to indemnify and hold Let's Talk Wellness Now and its associates harmless from any claims or damages arising from the use of this content. We may update this disclaimer at any time, and changes will take effect immediately upon posting or broadcast. Thank you for tuning in. We hope you find this episode both insightful and thought-provoking. Listener discretion is advised.